Wonderful. Thank you so much for having me. I'm Nadeen Israel. I use she, her pronouns, and I am the Senior Vice President of Policy and Advocacy at AIDS Foundation Chicago. I'm here representing the Protect Our Care Illinois Coalition. AFC is a member of Protect Our Care. And POCIL is a coalition that started during Trump 1.0 at the beginning, really trying to fight back the attacks that were coming at that time on the Affordable Care Act and Medicaid. And we've stayed together and tried to do some proactive work in the in-between time, and unfortunately have had to come together again this time around for Trump 2.0 and the tax that we are all fighting against this time around as well. So I was asked to provide a quick update on the budget reconciliation process and where we're at. I know lots of folks, probably all of you, are following this as well. So folks should definitely feel free to chime in and share their perspectives and edits and any corrections to anything I share. And there's a lot in there, as you all know, so I'm not gonna touch on everything, even related to Medicaid and the ACA and SNAP. But I'm gonna highlight the things that I think are a bit more important, and also getting more traction in terms of proposals. I'll also, once I'm done, put a couple of, there's like two resources or three resources that I'll put in the chat. One of them is it's like a table that Kaiser Family Foundation did, and I found it really helpful that shows like what the changes are to Medicaid and the ACA and actually Medicare as well within the House Budget Reconciliation Bill. So I'll drop the link in there so folks can have it reference it if they need to later. The second is an article of the things that I've read since that bill passed. I found this article to be one of the more helpful ones. It's a political one, so I'll drop it in there. And then the third is a one-pager that Center for Budget and Policy Priorities put together that is specific to Illinois in terms of how the budget reconciliation bill will have an impact as passed by the House, would impact Illinois Medicaid and Affordable Care Act in particular. I'll also dig up Greater Chicago Food Depository has a whole toolkit for the SNAP provisions. So if folks haven't seen that, I found it super helpful on the SNAP stuff. So I will drop those in the chat once I'm done kind of more verbally sharing. To make sure we're on the same page, where are we now? June 4th. So I think it was last week or the week before. I think it was last week. The House passed their version of the budget reconciliation bill. As a reminder, this is a process that doesn't have to happen in Congress. Like they don't need to pass a budget reconciliation bill every year, but it is a process that has been used in the past. It was actually used for passing the Affordable Care Act, for example. So it is a process that is used, but it's not something that has to happen every year in Congress. They are using it for a particular purpose. They would like to extend the tax cuts that the Trump administration passed in 2017. They expire this year. Most of those tax cuts that happened in 2017, most of the benefit went to the top like 10% of the income earners. And so 90% of us really didn't benefited very little, if at all, from those tax cuts. But Trump campaigned on this, and the entire goal and purpose is to extend those tax cuts. That's why they're going through this budget reconciliation process. But in order for them to do that, the part of the way the process works is they need to cut somewhere from the budget because extending those tax cuts would add to the budget deficit. And the process they're using, they need to find places to cut in order to extend those taxes. So that's going to add to the budget deficit. So they're looking for expenses to cut. And they have had their eyes, not surprising to any of us, laser set on Medicaid, SNAP as well, lots of other, both public safety net and also environmental programs. But Medicaid is one of the biggest targets because it's a big program that costs a lot of money. And so they've had their eyes laser set on the Medicaid. I mean, probably since the inception of Medicaid, but certainly in this process. So in basically less than 2 weeks, until I read one of the articles, I didn't process that it had been only that amount of time. But in about a 2-week period, The House Republicans introduced the budget reconciliation bill, marked it up in different committees, and passed it on the floor. It's over 1,000 pages. Um, it passed 215 yes, 214 no. All the Republicans that voted for, there were two that voted, I think, present and um, one that voted present and two that abstained. It turns out that the ones who didn't vote, it was like by accident. So they didn't make it back in time to vote. It wasn't because they would have voted no. Um, so it was a partisan roll call. All the Democrats voted against it. But as you can see from the vote tally, their margin in terms of how many people they can lose to kill this whole process is not very big. It's less than a handful. But right now they had what they need and they passed the bill. So specific to Medicaid and the ACA and SNAP in terms of what they actually passed, and then I'll share a little bit about like what's happening right now in the Senate because that's where the process is at. So one of the main pieces related to Medicaid is this piece about instituting work requirements. So really, hopefully everybody is very comfortable in this language in terms of work requirements don't work. They're essentially adding red tape and administrative barriers to a program that in order to kick people off and keep people off so that they can save money. That's a big part of how they would save money. They say, and the bill says that there are exemptions for certain populations on Medicaid from the work requirements, but it's not clear how those exemptions would be applied. And so when it's not clear, it could mean that the person has to prove all the time that they're engaging in work in order to stay qualified and on Medicaid. And we know again that that process of needing to prove yourself, whether it's your income or work requirement, whatever it may be, is where people fall through the crack and then they lose their Medicaid. But again, if we keep the larger point in mind and their larger goal, the Republicans' goal is to cut Medicaid. And so this instituting work requirement is the way to cut Medicaid drastically costs because people will fall off. Hundreds of thousands, if not millions of people will fall off. And that's how they get a bulk of their savings. They also make other changes to Medicaid. So instead of renewing once a year, renewing eligibility once a year, they're putting twice a year renewals and eligibility. They have a provision that would charge a copay up to $35 for certain Medicaid services. Again, some services are exempt, but if you've ever been to a doctor's office and tried to, tell them that they are, they're charging you for something that they shouldn't be charging you, and lost that battle with private health insurance, you know that even with exemptions, the reality is people will get denied care if there's a cost sharing requirement. Another big provision is around immigrant coverage. So it basically punishes states like Illinois who use their own money, who use their own state money, not federal money, state money, to cover some undocumented immigrants and some documented immigrants as well. So the bill, the way the House passed it, it punishes states for using their own money, not just for covering some undocumented immigrants, but also for covering some documented immigrants. Because just because you're a documented immigrant and poor doesn't mean you would qualify for Medicaid right now. There's still other provisions that you need to meet. And Illinois has decided to use its own state dollars to cover some documented immigrants as well. Again, not with federal dollars, but the way the bill is phrased is that it would punish those states by reducing their FMAP, so reducing the amount of money that the federal government gives that state for the Medicaid expansion population in particular by 10%. What that would translate to if it were to happen in Illinois is, I think, just under $2 billion a year is what it would cost us to take that 10% hit, or we would have to drop the coverage, the Medicaid coverage of both the documented immigrants that we have that the federal government is saying you can't cover them even with your own money, and the undocumented immigrants coverage. That's Medicaid lookalike is what we call it. So that's the between the work requirement and that piece are pretty big pieces in terms of financial costs, and pieces that will, if they happen, there'll be decisions at the state level that then have to be made, that our state legislature, our governor will have to make. Other pieces that might be helpful for this group, or just to, in case you had not heard, is Planned Parenthood is can't be a Medicaid biller for 10 years. And the way, if this bill were to become law, they ban even for not abortion. So abortion already can't be covered by Medicaid services. That's never been a thing. But Planned Parenthood, as you know, covers lots of services that are not abortion for men and women. But the bill language, the way it's worded, is Planned Parenthood would not be able to bill Medicaid for any Medicaid services for a 10-year period. And they don't put the words Planned Parenthood in there, but the way the language is drafted, it's specifically targeting Planned Parenthood. That's who fits it. It bans the coverage of gender affirming care for adults and minors, children under 18. There are provisions related to providers, so the provider assessment, provider taxes. I won't go too into them, but the reason why those are important is because that's how a state like Illinois essentially gets more money, is able to bring in more money from the federal government for our Medicaid program, is through those some of those provider taxes and MCO taxes. So it's changes to those mean less money coming to Illinois to pay for the Medicaid program. But again, if we keep the larger point in mind, their larger goal is that's their larger goal. They say they want to eliminate waste, fraud, and abuse. They want to make sure that people who qualify are the only ones that are on there. That they want to make sure they're incentivizing people who can work to work. None of that is that. They don't. They will say that because that is a thing that they will say, but we know that that's not true. Their goal is to kick people off, to save money so that they can extend the tax cuts, the 2017 tax cuts. That's it. I'll stop there on the Medicaid front piece. The ACA piece is basically the ACA piece is Affordable Care Act are around. Some are around coverage. For example, they ban gender affirming care coverage also on the marketplaces. So private health insurance for adults and young people. But a lot of the ACA provisions are around like shortening the open enrollment period. The enhanced subsidy that millions of people got in order to help them pay for their marketplace plans. That expires this year. They're not extending it. So that's going to mean loss of coverage for like a few million people that right now have their health insurance through the marketplace on the ACA. There is like right now in the ACA, if you're on an ACA plan, if you're in a plan and you don't pick a plan, they'll automatically renew you in the current plan that you're in. You don't have to do anything. They remove that cover, the automatic re-enrollment away. Basically, again, putting in administrative barriers so that less people will be able to benefit and have health insurance through the ACA. Let me pause there on the Medicaid and the ACA, and then I'll say just a couple of things on SNAP that I'm gonna borrow from my colleagues at Greater Chicago Food Depository. Any additions, edits, or questions?
I was just going to ask Nadine, with the version that they passed, do we have an estimate of how many people we think would drop from the Illinois Medicaid program who would lose coverage?
Yeah, we over 600,000 was the number.
Okay.
In terms of for I believe that's just Medicaid alone.
Yeah.
Um, yeah.
Thanks.
Okay. Let me go to this next one. Okay, let's switch to Snap. Or do we have something in the chat? Okay. I don't see anything in the chat, but I'm assuming somebody else will monitor if there is.
Yeah, I'll let you know. Thanks.
Thank you. So let me now, so on the SNAP side, one of the pieces that I think is like one of the most cruel one changes that they're putting on the SNAP side is they're changing. So SNAP already, as you know, has a work requirement for some people. States are able to like waive out of that during certain time periods. So if it's like your unemployment rate as a state is at a certain point, high essentially, but at a certain percentage, you can apply for this waiver, and then you don't have to be implementing the work requirement during that time period. They're getting rid of that in this bill, the ability to waive, the work requirement in SNAP. But they're also lowering the age of a child who counts as a child for SNAP to up to 7 years old. And so if you have children in the household, right now it's 18. But if you have children in the household that are 8 years old, 9 years old, that are your dependents, you would still have to meet the work requirement that they have put in there for SNAP. So again, it's like work, education, training, and on the Medicaid side, it's 80 hours a month. I'll double check. I think it's similar, if not exact, on SNAP side, but I'll double check it. So again, what does this translate to? People losing access to SNAP, to their SNAP benefit, and more parents of young kids losing access to their SNAP benefits, or not having access to them regularly, depending on the seasonality, etc., and just ability to prove that they are meeting the requirement, which is really the main battle. All right, I'm just scanning through. Okay. I'm looking for the number in terms of, because GCFD did a webinar on this recently and they had a impact number. Impact. Okay. So on the SNAP, the time limited SNAP benefits, so the impact would be between the work requirement and having that 3-month time limit for able-bodied adults without dependents for SNAP. The impact in Illinois would be 472,000 Illinois residents, including older adults and children, would be at risk of losing some or all of their benefit. So this represents about 25% of Illinois SNAP caseload right now. And 229,000, I'll put these in the chat as well. 229,000 Illinois residents are at risk of losing their entire SNAP benefit if this bill were to become law. Okay, I'll pause there again to see if there's anybody else that has anything to add or edit or share or ask about SNAP, and then I'll just do a couple of minutes on what's happening now because this process now is moving through the Senate, the US Senate. Okay. And I apologize. I know this is a lot of when I'm sitting and listening to this kind of information, it like is like a huge uh, downer, and not that it's new probably for most of you. But there's a lot that we can do to stop this thing, in either in whole or in part, at least for parts of it. So very quickly, now that the US House has passed their version of the bill, the Senate needs to do the same thing. And well, they don't need to, but the Senate will try to do the same thing. And if they're successful, if the two versions don't, they likely won't match. What would need to happen then is that Senate bill would go back to the House, and the House would need to pass it before it can get to the president's desk. So they would need to get to agreement even after the Senate passes their version on one shared bill that they have both voted on before it can get to the president's desk. So the Senate has said that a couple of things are different in terms of process on the Senate side. The House had committee meetings that were public, markups, where they discussed the bill for hours. The Senate is not going to do public. They're going to do all their work behind the scenes. We may see leaked versions of the Senate version, so we're going to keep an eye out as early as like today or tomorrow. But like more likely next week, it's seeming like we may see some either leaked or actual versions of the bill on the Senate side. They are looking to pass their version in the Senate the week of June 23rd because they are trying to wrap this whole thing up and put a bill on Trump's desk before July 4th, before the July 4th holiday. So again, very, very expedited timeline. Obviously, for them, the longer this drags, the more people hear about what's happening and how bad it is, and are screaming at them. So that's why they're trying to speed it up. So our goal as advocates, our entire goal has been and will continue to be to slow this down. The more we can slow it down, the more we're winning. And the more we will be able to win at the end of the day overall. So we have a couple of weeks basically to make our phone calls. I know lots of folks have action alerts. I'll drop a couple in the chat, but at a minimum, I would encourage you to please send your emails, make your phone calls, encourage everybody you know in your orbit, coworkers, friends, family, partners. Send your email, make your phone call, and if you can, get on social media. And if it's a Democrat from Illinois, they're with us right now, so that it's a thank you for them. If it's a Republican from Illinois, they're not with us right now. So LaHood, Miller, and Boss are the Republicans that represent Illinois in Congress. They're not with us. They're voting against us on all these issues. So especially if you're a constituent or no constituents, getting on social media and calling them out on their vote is really, really important because they do pay attention, and we know Trump pays attention to social media. If you are looking for other ways to get involved, I would say at a minimum, getting on Protect Our Care's email list might be helpful. You can reach out to me and I can make sure that happens. Whatever stories, sorry, one other thing, and then I'll stop. We are collecting stories both on SNAP and Medicaid, and reporters right now at this particular moment, especially are looking for stories of people on Medicaid who would be impacted by that work requirement. So the parents of young kids, the single childless adult, the ACA adult, that's who they're looking to talk to. I have three at least open asks right now, and it's been hard, honestly, finding. I've had an easier time finding folks willing to share their story who are not Medicaid expansion than who are. So if you have connections to anybody, if you can reach out to me today, that would be super helpful. Who's willing to share their story? If you have connections to somebody who is willing to, but like needs a little bit of coaching or help, like before they talk to the reporter, that's totally fine. Either I can do that, or somebody else from Protect Our Care who is experienced can do that as well. If you cannot. Okay, let me look at what's the difference between this budget and what's been considered in the Senate. So that's a great question. So the question is, what's the difference between like the House budget reconciliation bill that passed and what the Senate is considering? The Senate so far has said the House, it's kind of a mixed bag. Some of the Senate has said the House version is too dramatic when it comes to cuts to Medicaid. Some have talked about SNAP. But others in the Senate are saying the House version doesn't go far enough. Trump, as Trump is all over the place. He said, don't touch Medicaid. We're not touching Medicaid. Clearly they are. And he said, Medicaid needs to be tightened up, waste, fraud, and abuse, blah, blah, blah. So the expectation is that the Senate version is supposedly not going to be as bad as the House version, but the reality is, from my perspective anyway, even if they cut $1 out of SNAP or Medicaid, that's $1 too much. Because if we keep in mind the reason why they're making the cut, it's to give money to like millionaires and billionaires. Those people don't need anything else. They're literally ripping away healthcare and food from low and middle income people and people in poverty to give it to people who will not even notice that they have it, that they have the extra money. So you might hear over the next couple of weeks, oh, like the Senate version is like not as bad, not as dramatic in terms of the cuts as the House. But again, keeping in mind that any cut is unacceptable. None of this needs to happen. The conversation should be focused on investing in Medicaid, investing in SNAP, programs that work and save lives. The only reason we're having this conversation, the only reason we're all engaged in this advocacy is because they want to give tax breaks to millionaires and billionaires.
Yeah, thanks, Nadine. I think the question was referring to the proposed FY 2026 budget, which is also floating out there right now. compared to
Um,
what's going through, which is the FY25 reconciliation.
Sorry, thank
No
you.
worries.
So the FY26 budget is that's the normal process. That so every year, the city, county, state, federal government needs to pass a budget. So the FY26 budget, which it's kind of picking up, Trump released his version of it, his proposal, I think last week. That's the normal process of passing a budget that needs to happen every year. So, for example, for HIV, in the FY26 budget is where the HIV cuts are. They're eliminating an HIV housing program that's existed since 92. A lot of the public health programs cuts are going to be in that fiscal year 26 budget. So this is cuts on top of cuts, basically. But they are two different processes to Jana and your point. I think, I don't know if it was Janet that asked the question. And they're on two different timelines. The fiscal year 26 budget is like really picking up. That process is picking up now, whereas the budget reconciliation bill maybe is like a little less than halfway through its process right now. Jenna, is there anything else that you would add to that or like edit or correct?
Um, no, I just know there's also there are there's cuts to CDC funding, even though it's not the restructuring that's proposed in FY26, the FY25 reconciliation continues to cut public health as well. So there's the Medicaid, SNAP, public health CDC cuts, um, including to chronic disease and things that this coalition focuses on. So yeah.
Yeah, that's a good point. So again, a reminder that the bill is over 1,000 pages, so we're focusing on big parts of it, but there's a ton that isn't getting as much traction, and there are cuts, real cuts in the budget reconciliation. Thank you, Janet. Okay, I think I will stop there, and then I'm gonna mute myself and then put some stuff in the chat and turn it back over to y'all.
Nadine, does anyone else have any other questions before Nadine goes? All right, thank you so much for sharing.